Hey friends, it's Jordan here, and I want to talk to you a little bit about the reality acceptance skills in DBT. So reality acceptance skills are part of the overall skill module we call distress tolerance. Distress tolerance skills are important when we have a lot of distress, when we have it could be for a crisis situation, or something that feels like a crisis, even if it's not, or we just have a lot of overwhelming emotions or urges or physical or cognitive experiences that are just too much distress. So on one hand, we have crisis survival skills that we've talked about in another video. And on the other hand, we have reality acceptance skills. Reality acceptance skills are used specifically for when the life that we're living or the moment that we're experiencing is not the moment or not the life that we want to be living or that we wished we were living. So a lot of times we know that we need reality acceptance skills if we're having a lot of thoughts like it shouldn't be this way, or why me, or why do I have to go through this, or that person should be different. And not just a casual thought, but a thought that and a feeling that causes a lot of distress. Maybe a lot of bitterness, maybe a lot of feeling stuck and helpless. So reality acceptance skills, there's several of them. And the main purpose of them, it's not just to accept our life and be miserable. It's not just to give up on trying to make things better. However, it is to accept kind of the normal pain of life. Kind of acknowledge that life doesn't always turn out the way we want it to. And in the moment, in any given moment, we might be experiencing a lot of suffering and a lot of pain. So we want to accept the inevitable pain of life so we can clarify what we can do, what we can change, rather than getting caught up in should or shouldn't or wishing things were not the way they are, right? So when we practice reality acceptance skills, there's several different types. There's radical acceptance, which is accepting with fully the present moment, including the past that has caused the present, accepting it fully, heart, mind, body, soul, everything. Acceptance here is not the same as approving, liking, or kind of approving of the reality or liking the reality or even loving the reality. Acceptance is kind of a deep acknowledgement of the facts as they are. So radical acceptance is one reality acceptance skill. Another one is called turning the mind. So turning the mind is kind of the continuing to radically accept, to be willing to be in the present, to be willing to be in the life that we have. So it's more of a choice. Whereas radical acceptance is maybe the experience we have for a few seconds when we can really be there in the present moment and be with it. Naturally, we're going to kind of shift out of that mode of acceptance oftentimes, especially when we're starting this out. So turning the mind is kind of that choice to bring ourselves back to a commitment to accept the things we cannot change, right? You might hear serenity prayer in that, right? So a big part of DBT and other therapies and just life is figuring out how to accept the things we cannot change, figuring out how to have the courage to effectively change the things that we want to change or that we can change, and how to have the wisdom to tell the difference. And that's the basic serenity prayer. DBT is very much an operationalized kind of way of living the serenity prayer. So the reality acceptance skills, again, we have radical acceptance, we have turning the mind, then we have willingness. And in another video, I'm walking you through how to get to willingness step by step using these other skills. One of the things that helps us with willingness is using a half smile and willing hands. So paying attention like physically to our body posture and opening up our body posture to life, to reality, to our emotions, to our inner and external experience, and then using our facial muscles to relax our face and kind of bring a half smile. So that's kind of part of half smile and willing hands. So all of these, as well as what we call mindfulness of current thoughts. So when we have distressing thoughts or racing thoughts or ruminating thoughts, we can use observing those thoughts, mindfulness of those thoughts, noticing them come and go like waves. All of those are reality acceptance skills. They're very powerful skills in DBT, and they're kind of congruent or correspondent with skills from other types of therapy, other types of mindfulness-based therapies, including acceptance and commitment therapy. Right? In that kind of therapy, ACT, it's kind of like a cousin to DBT. It's right in the name that acceptance is a huge part of this therapy. Accepting the things that we cannot change, accepting reality for what it is. And sometimes it's things we can change, and yet acceptance, opening up to it, being with it, letting go of fighting it head on, allows us to be more effective in changing what we can change. So that's one of the myths, that as you use reality acceptance, you might have some resistance. You might have this feeling of, no, I can't lose that kind of tight grip or control or that fight first mentality towards reality, right? And you'll find that as you use reality acceptance skills, you will likely become more effective and more empowered to change things you want to change. You'll stop fighting battles that you don't need to fight. You'll kind of have clarified for you what you can spend your energy on.